I'm the PA student.
Nice to meet you.
Can you just verify your name and date of birth for me?
My name's Bryn, my last name's Spezzoletti, and my birthday is 11/16/95.
Okay. What brings you in today?
I've been having some issues with shortness of breath when I'm exercising.
When you're exercising.
Mm-hmm.
And how long has this been going on?
I've been trying to get in shape more recently, so I only have been noticing it within the past month, when I try to work out.
Okay. And Bryn, what do you do for your occupation?
I'm a student right now.
Okay. And how would you describe your general health before noticing the shortness?
Pretty normal. Like I said, I've been trying to just get in better shape and go to the gym and stuff, which I haven't done as much. But I eat pretty healthy. Nothing out of the ordinary.
Okay. And are you married?
No.
And so you said your symptoms started beginning a month ago.
Mm-hmm.
And when did you notice?
I guess I was on the treadmill, and it's probably been I was running for 5 or 6 minutes, and I just felt so short of breath and that I couldn't do anything more. And I didn't really think anything of it because I thought I was just really out of shape, but it hasn't increased as I've been trying to get in better shape. So I just keep getting short of breath, and I can't get past that 6 or 7 minute mark.
Okay. And how long does your shortness of breath usually occur?
Sometimes it can take a couple of minutes, probably 10 minutes to subside.
And do you usually stop running then?
Yeah, I have to stop running because it's painful, it hurts.
Okay. And does anything make the symptom worse?
If I would try to keep going, that makes it worse. But when I stop, it doesn't get better right away. But with time, if I just take some deep breaths and don't do anything, then it will get better. It gets better.
Okay. Are you taking anything for medicine-wise? Do you take any medicine?
I'm on birth control. That's it. And I'll take ibuprofen and stuff when I need it. If I have a headache or whatever.
Okay. Do you take anything when you notice the shortness of breath?
Mm-mm. No, I just stop whatever I'm doing and try to catch my breath.
Okay. And has this ever happened to you before?
Not really. I didn't do, in high school I cheered, so I didn't do a lot of running and stuff like that, so I never really noticed it. So I guess no, it hasn't really happened before.
Okay. And how would you describe your shortness of breath? Is it, do you have heaviness in your chest?
It's just it almost gets tight.
It's tight?
Yeah, and it's painful. It's I feel I just can't get any air in.
And it's painful, you said?
Mm-hmm.
Can you describe the pain for me?
Kind of just a burning sensation, probably.
And does your pain radiate anywhere else to your body?
No, it's just my lung, my chest areas.
Can you, using one finger, can you point to me where it?
I feel it's in this general, just almost with my ribs. All in that area.
For the tightness?
For the tightness, yeah.
And then for the pain?
For the pain, it's the same thing. I feel it's all over.
Okay. All right. And from a scale of 1 to 10, with 10 being the worst pain you've ever felt, can you rate?
I would give it a 6.
Okay. And do you notice your shortness of breath being more prevalent at a certain time?
Just with exercise.
Just with exercise.
Mm-hmm.
Okay.
I haven't noticed it any other time.
Okay. All right. And you said you're on birth control.
Mm-hmm.
Do you know the name of your birth control?
It's called NuvaRing.
Okay. And so then how, do you know the dose?
I'm not really sure. I just know that I have to have a new one every 3 weeks.
A new one every 3 weeks? Okay.
Yeah.
And have you changed birth controls recently or dose?
No, nothing's changed.
Okay. And you said you also take ibuprofen as needed?
Yeah.
Okay. And how much do you usually take?
Usually I take 2 or 3, depending on how painful whatever it is.
Do you know the strength?
Usually 200s.
200.
Mm-hmm.
Okay. And are you allergic to anything? Any medicines or food?
Yeah, I'm allergic to the amoxicillin and penicillin family.
And what kind of reaction do you get when you're exposed to this?
It was like when I was little, I had like a really, really bad stomach ache, like needed to drink like the liquid type, and they just like stopped giving it to me then.
You just had a stomach ache?
Mm-hmm.
Okay, and how old would you say?
I was probably in like 5th grade, so like 12-ish.
Okay. And are you allergic to any foods or insects?
Yeah, I'm allergic to like tree nuts, so like pecans and walnuts and stuff.
And what happens when you're exposed?
If I would like eat it, my mouth kind of just like swells up.
Okay.
Yeah.
So it sounds like the first one is kind of more of an intolerant than
Yeah.
an allergy, but the tree nuts is definitely, you get a big reaction. Okay. And when was the last time that reaction occurred?
Probably like 2 years ago.
2 years ago. All right. Any latex allergy?
No.
How about iodine?
No.
Are you allergic to chlorhexidine?
No.
Okay. All right. Tell me about your childhood illnesses. Did you have any illnesses as a child that you remember?
Yeah, I had chickenpox when I was little.
Okay. What age were you?
I think I was about like 2.
Have you ever had measles?
No.
Mumps?
No.
Rheumatic fever?
No.
Scarlet fever?
Mm-mm.
Have you ever had polio?
No.
Have you ever been diagnosed with a psychiatric disorder?
No.
Okay. And then we're just going to go into a little bit of childhood immunizations. So
Okay.
have you ever been immunized for polio?
Yes.
Okay. And do you remember how old you were?
I'm guessing that's one that you get when you're a baby, but
Okay.
yeah, I'm not really sure.
Okay. Have you ever gotten the measles, mumps, rubella?
Yeah, I've had that one.
Do you remember how old you were?
Probably when I was a baby too, yeah.
Okay. How about the flu?
Yeah, I actually just got my flu shot like probably 2 weeks ago.
And have you ever gotten the tetanus shot?
Yeah, probably. Oh, actually no, I got it a couple months ago. Yeah, because I needed a new one, that's right.
Perfect.
Mm-hmm.
And how about diphtheria?
I don't believe so, I'm not sure.
Okay, pertussis?
Yeah.
Was that one recent or?
I feel like I've had it, but I can't exactly remember when.
Okay. Hepatitis B?
Yeah, I'm actually in the process of redoing that immunization.
Okay, so you're getting it.
Yeah, I have to get my 3rd round soon.
Fun.
Yeah.
Chicken pox?
So I had chickenpox, so I never got the vaccine.
Okay. And pneumococcal vaccine?
I don't believe so.
Okay. Okay. Any other illnesses, childhood illnesses you can think of?
No. I think like I had a really bad cold or something when I was a baby, but nothing crazy.
Okay. Well, we can certainly document that. Did you have to be taken to
The hospital, yeah. I think it was like an upper respiratory infection. But that I was just so little because I had my older brothers and they brought home germs from whatever it got me sick. But
did you have any complications from that?
no.
Okay. And then, do you have any illnesses currently or previously?
Nope.
Hypertension?
No.
Do you have diabetes?
No.
Tuberculosis?
Nope.
Heart disease?
Mm-mm.
Lung disease? How about kidney disease?
No.
Or thyroid disease?
Nope.
Have you ever had HIV?
No.
Have you ever had seizures?
No.
Cancer?
No.
Asthma?
No.
Hepatitis?
No.
Well, very good. You seem healthy. Have you ever had any accidents or injuries that you've been treated for?
No. Nothing I've been treated for.
Okay. Any that you haven't been treated for?
No.
Have you ever been hospitalized besides the one that you just mentioned about?
When I was a baby, no, I haven't been hospitalized other than that.
Okay. And have you ever had any surgeries?
I had, like, wisdom teeth
Okay.
removal. I guess that counts as a surgery. Yeah. And I also had an ingrown toenail surgery.
Ooh.
When I was, like, younger.
Okay. And do you remember the dates or even years?
My wisdom teeth was last year, so 2016.
Okay.
And the toe one, probably like 2010.
Okay. And did you have any complications from either of those?
No.
And outcome?
No more wisdom teeth, no more ingrown toenails.
Very good. Okay. All right. Have you gotten the flu shot?
Yeah, I have.
This year?
Yeah, I got it, like the new one for this year already.
Hepatitis B?
Yep, in the process.
Okay. The zoster vaccine?
No.
The pneumonia shot?
No.
Have you ever gotten a mammogram?
No.
No? Okay. Have you ever gotten a colonoscopy?
No.
Have you ever gotten a pap smear?
Yes.
Okay. When was your last pap smear?
Probably December of last year, so 2016.
Okay. And any atypical findings?
They never called me, so I guess that means everything was okay.
Okay, good. Have you ever had a DEXA scan?
No.
TB test?
Yes.
Recently? Was that this past year?
Yeah, I had 2 in like June of this past year.
Okay.
But there was no reaction or anything.
Okay. How about a cholesterol test?
No, I haven't had one.
And a cold blood stool test?
Nope.
Doing well. Okay, now we're just going to talk about your health history. So, at what age did you first get your period?
I think I was like 13.
Okay. And how often and how long is your typical menstrual cycle?
Since I'm on like the ring, it's just like 1 week. So, but I think I only have like my period for like 4 days max.
Okay. And you get it usually every 4 weeks?
Yeah.
Once a month?
The 28-day thing.
Yeah, okay.
Yeah, I'm like regular.
Great. And how would you describe your typical flow? Is it light, medium, heavy?
I would probably say it's medium.
Okay. And when was your last menstrual cycle?
I think it was like 2 weeks ago.
Have you ever experienced any amenorrhea, so not getting your period for a month or a couple months?
Like in high school I had that happen, but never since then.
Okay. So not for like the past
4
4 years.
4 or 5 years it hasn't happened. It was only like a one-time thing.
Okay. Have you ever experienced any extremely painful periods?
Yeah, that's why I had to go on birth control.
Okay. And you don't have those symptoms anymore after?
It's not as bad. Like I used to get like super like bad back pains and like shakiness. It was kind of weird. But then like the birth control helped
Helps
a
a
lot.
lot.
Yeah.
Good. And when you said you got your pap smear?
Yep.
Have you ever had an STI before?
No.
Have you ever had a pregnancy?
No.
Now we're just going to talk about your family a bit. So,
Okay.
Do you know about any conditions that run in your family?
I mean, my dad's a smoker, so I guess he brought that stuff upon himself, and like his family, they were smokers. But on my mom's side, I know my grandfather had prostate cancer, and my grandma has varicose veins. But my mom, in general, like she doesn't. Oh, I guess she gets migraines sometimes.
Okay.
Yeah.
Alright, so you can start with your dad. How old is he?
My dad is 58.
Okay. And you said he's a smoker.
Mhm.
Does he have any other conditions?
He has like anxiety and depression, but nothing like related to smoking, really.
Okay. And how old is your mother?
My mom's 56.
And you said she gets migraines.
Yeah.
Anything else?
No, nothing that I know of.
And both of those are still alive, correct?
Yes.
Okay. All right. So tell me about your dad's dad.
Dad's dad, he passed away when he was probably about like 83, around there, low 80s. He had dementia, and he also had depression, and he was also a smoker.
And how about your grandmother on your dad's side?
She is still alive. She is 81. She has COPD because she was a smoker, and now she can't smoke. But that's pretty much the only thing that she has. COPD and asthma, she says, but I feel like that's the same thing.
Yeah. Okay. And how about your mom's dad?
He passed away when he was 87. He had a stroke, but other than that, like, he was always in good health. So.
And how about her mom?
She's 88, still living. Only thing she really has to deal with is like her vein issue. Yeah, she's in a very good like circulation, like with that stuff. But
other than that, in good health.
yeah, other than that, she's good.
Good. And then, do you have any siblings?
Yeah, I have 2 older brothers.
Okay. And what are their names?
One's Matt, and the other's Ben.
How old are they?
Matt is 27, and Ben's 24.
Okay. And do they have any conditions or how's their health?
Yeah, they're both very healthy, like gym freaks, and eat healthy. Yeah, they don't have any medical issues.
Good. And so you don't have any children?
Nope.
All right. Perfect. So you have a family history of migraines, headaches. I guess they're kind of similar. So,
Yeah.
Any family history of seizures?
No.
Stroke?
Yeah.
And mental illness?
Yeah.
Any suicide?
No.
Any substance abuse?
No.
Thyroid disease?
No.
Coronary artery disease?
No.
Hypertension?
No.
Elevated cholesterol levels?
No.
Diabetes?
No.
You said asthma and COPD is relevant. How about tuberculosis?
No.
Renal disease?
No.
Arthritis?
No.
Allergies?
Yeah, like my whole family has like the whole
The seasonal?
seasonal stuff, but
allergies?
yeah, nothing other than that.
Okay. And do you know if anybody in your family has had these type of symptoms before, the shortness of breath upon exercising?
No, not that they've like mentioned to me or have Just me.
Okay. And any history of ovarian cancer, breast cancer,
No.
prostate cancer?
Prostate, yes.
Did you mention that?
Yeah,
Oh yeah, your maternal grandfather.
Yeah, maternal grandfather.
Anybody else that you?
Not that I know of.
What, colon cancer?
No.
And lung cancer?
No.
Any family history of any genetically transmitted diseases?
No.
Okay. All right. And we're just going to talk about a little bit about you.
Okay.
So, where were you born?
I was born in Reading, Pennsylvania.
Okay. And tell me about your childhood. How was that?
Normal childhood. Yeah, nothing out of the ordinary.
Okay. What's normal for you?
Both my parents worked, and I went to Catholic school. Older brothers did normal. I had my friends, hung out with my friends. I did dance and cheer when I was younger.
And a good relationship with everybody?
Yeah. Me and my brothers weren't close when we were little, but we're closer now that everyone's older.
And you're a student now, so what year in college?
Senior.
Senior.
Mm-hmm.
Very nice. So tell me about your living environment.
So right now I have an apartment. Because I have a house at home too, with my family. I still live there. But right now, when I'm at school, I have an apartment, and I have 4 other roommates that I live with, and we're all pretty much the same age.
And how many steps are in that?
Oh gosh, I live on the 3rd floor, so there's a lot of steps. I think I counted them. I think it's 12 and then 13. So is that 25? Yeah.
And any steps leading into?
Oh yeah, there's 3 steps to get up into the house.
Okay. And you said there's 3 floors.
Yeah.
Okay. And do you have any relation to your roommates?
No, we're just all friends.
Okay. And do you feel safe at home, not only with the environment, but with the people that you're living with?
Yeah.
Okay. And are there any pets that are there?
No.
No? Do you have any recent or long-term stressors in your life?
Just school can be stressful, yeah. And I have, I work, I have part-time job, but nothing other than that.
And where do you work?
I work at our student center.
On campus?
Yeah.
And what do you usually do to help your stressors?
I like to do deep breathing exercises.
Oh, that's very good.
Yeah, or I just talk to someone about something else. I like to vent. So.
Good. Were you ever in the military?
No.
And tell me about your financial situation.
And I'm a college student, so it's not much there.
Do you get any help from family members?
Yeah, my parents support pretty much everything while I'm here. Spending money's on me, but
That's good.
Mm-hmm.
And then what do you do in your free time, or what do you do for fun, I guess?
And I like to go out to the bars and stuff now, I'm 21, with my friends. Also food, we like to go out to eat a lot. But just hanging out. We'll all sit and watch TV or watch a movie.
Great. So you'd say that you have a pretty good support system with your friends?
Yeah, I have some great friends.
And your family?
Yeah, very supportive.
Do you have any other support systems outside of friends and family, any religious affiliations or groups?
I do I would say that I'm Christian, but I don't really see that as support and like that
Okay.
sense. But yeah.
Great. Well, thanks for coming in today.
All right, thank you. Oh, you have to put your password in to stop it.